think for us, whenever I look at any kind of modality like this to help with taking care of patients, there's a few things that we're looking at. One is safety. Obviously, we want it to be something that's going to be safe for the patient. And so we haven't seen any kind of increased rate of infections or other issues or concerns with this method. So I think that's most important. It's nice that it comes in a sterile packaging. It's a sterile pouch. So we feel very comfortable that we're using a sterile, safe product for the patient, and we're not incurring any new risk for the patient in the procedure. So I think that's number one, and we've been happy with it from that standpoint. Secondly, second most important thing is we want something that's going to be effective for the patient. So efficacy, does it numb the way that it should? And it does. And so there, I think that's kind of the second most important thing that we look at with these are we getting the desired result, and is the patient happy at the end of the procedure in terms of its ability to appropriately anesthetize the eye? Because these are patients that are coming back very frequently. They're getting many injections, often on a monthly basis throughout the year. We want something that's as comfortable as possible for them so that they can, tolerate this procedure, which is so important for them to retain their vision, and in some cases improve their vision, but we want it to be a comfortable experience for them. So we want efficacious product, which this has been for us. And then lastly, the third kind of most important thing we look at is the efficiency of the product in our patient flow environment. And this has helped us in terms of our office efficiency, because I'm able to keep moving along while the technician can perform this part of the procedure in terms of getting the patient anesthetized and ready for me to come in the room and treat the patient. So we're able to process more patients more effectively, be more efficient in our processes. So I think, along those those tiers is what we're looking for with respect to the product. And if you're a person using an injection right now, I feel like it's a much easier switch, because at the very least it's not more expensive, and you're saving yourself a ton of time now, because you're switching from having to do an extra injection. So you're getting basically the same result of numbing the patient, safety, efficacy. Now you're more efficient though, because you're not having to numb them. So I think that's an easier transition.